Hello, everybody. Welcome to our latest episode of Cambrian Explosion, where we're going to talk about the cost of healthcare in 2024. So I'm going to give it over to my friend Nabil to chat about a story he had to start us off on the podcast.
Yeah, Canada has been a blessing in many ways. And one of the big blessings has been that my dad has had back problems and having the Canadian healthcare system and being able to go to the doctors is so good, particularly when you look further down south and the challenges that are in the US healthcare system. And so I'm very blessed to have enjoyed the benefits for my dad specifically of the Canadian healthcare system. But at the same time, you know, it also has a lot of challenges. And Mavish, you mentioned about the story about the 911 call. What happened over there?
There was a 911 call where a woman had called in for help, and based on the article I read on, I believe it was Global News, basically something happened where she called, then canceled the call, and along this way, unfortunately, she ended up passing away. And it's more about the fact that no one responded to this 911 call. And you would think that when you were calling 911 and there's some sort of emergency, there's still some sort of process in our framework to check up on what happened there. Like if someone called in and that's a very serious thing to call 911 and then suddenly canceled, something still happened there, right? And we have to take that information as to what happened in that situation and do that. Otherwise, in this case, unfortunately, this woman was found dead afterwards, right? So the proper process was not done to ensure that she was taken care of. So it just brought up the question, what are we doing in our healthcare specifically to ensure that everyone is taken care of? And it's great to have free medical care in Canada. I think that's a great thing that we were able to do more than other countries. But at the same time, the level of care should still be there. Every year it should be consistent, and people should feel like they can rely on it more than having to go to other places to
So,
get better care. Yeah.
Yawer, you've been in Canada how long, and what has your experience with the healthcare system been?
I've been lucky that I haven't had significant problems personally. I mean, I've known people who've had problems, and it's difficult because I've personally seen that you go into the emergency if you have a health issue, immediate health issue, and you have to wait for like, I don't know, like maybe 6 hours. Nowadays, I hear it's more like 12 to 24 hours to waiting in emergency. Of course, this is all post-COVID, so things are different now. But even back then, before COVID hit, it was, not exactly a piece of cake to get into emergency rooms. Of course, I'm talking about Toronto, less busy places will probably be doing better in terms of emergency care. But then again, you run the risk of when you have you're in a small town and you don't get funded enough, then you're at the risk of your hospital could be at the risk of shutting down. We've seen shutdowns in Ontario already. So it's difficult because it's all kind of everything that we are seeing is pointing to that if the funds are stopping to, the flow of funds into public healthcare is slowing down. Somebody, it seems to be stopping it or slowing it down. And you hear about that there's plans for healthcare privatization. Even the liberals seem to think that some amount of private privatization is a good idea. So it looks like we could be heading for more privatized services. Of course, some political parties are fighting against that. Like NDP has much more. They always put a much more emphasis on public funded healthcare.
Mavish, what's your experience been with the current healthcare system And what are some of the challenges that you've seen on your side?
Well, I have a very different perspective. I'm a type 1 diabetic, and I'm very vocal about it. It's something that, especially in our culture, sometimes can be stigmatized. So, coming to Canada, I found that that was actually one of the bonuses. It's kind of such a interesting community to have here, where you have people doing that. Saying that, though, unfortunately, I have to say that if you're diabetic, because there's so many people who have either type 1 or type 2 diabetes, there's a lot of resources put into helping those people. Versus people, for example, who have a disease like Crohn's, which is also an autoimmune disease, there's not as many resources to help them. So anything where there's more money to be had, unfortunately, there's more level of care. Like I have a whole team behind me. I have a dietitian, I have a doctor, I have my family doctor. I could ask for more resources if I wanted, and they would just throw me to them. I can figure it all out by going to different communities, attending events specifically for that. But if I'm to compare it to something like Crohn's, unfortunately, there may not be as those same types of people to help you, or doctors would not think to give those resources to them, knowing some people in that community as well. As a woman, I think that there's a lot of resources for us as well that would cost a lot in other areas that I'm proud that Canada does have. So I have a bit of both sides of experience, but I will say that there are a lot of wait times. I've noticed something in the last 2 years for me personally. If you want to get a family doctor, for example, in Canada, sometimes I'll book an appointment, and the only way to see the family doctor is to wait 2 weeks. Sorry, not 2 years, 2 weeks or three
Yeah.
weeks to actually see a family doctor. And I've had that experience with family as well, where if you're sick or you have pneumonia or something, and you don't know what it is at that moment, you can't wait 2 weeks to see your family doctor to book an appointment. You would have to then go to the ER for that eventually, once you lose all the ways to get that appointment. And by that time, it might be too late. So as somebody who's very cautious of what's going on with me, I personally like to see a doctor right away just to be safe, because you never know. Versus some people, I know a lot of people who are like, oh, it's okay, I have to go to work. I'm just gonna wait it out. I'll wait 2 weeks, and then they have to go to the hospital, right? So in that case, people tend to put things off, and that's not okay, especially since you never know as you're growing older, like what you need to do to safeguard that. So I think that's something that we need to work on. There's tons of barriers for people to become doctors when they immigrate to this country. And I think that is something that is unfortunate, because we have a lot of very smart people that could be alleviating some of these wait times and helping to get people into the surgeries that they need to take rather than putting it off. Imagine your
Yep.
appendix is burst and you end up waiting two days to go to the hospital because you're not able to see your family doctor, right? So I
Yeah.
feel like there's a lot of challenges in our system right now.
I clearly heard one message for our listeners, which is take care of your health, slow down, take care of your health. That's really important. Take a minute right now to just slow down and take care of your health. One of the challenge that I keep hearing is that there's a lot of wait times, and that really sounds like a challenge of there's not enough specific dedicated resources. You mentioned one potential solution to it, having immigrants who have the qualifications but don't necessarily have the Canadian qualifications um, enter the system. But why is there a shortage in the first place is also a good question to ask ourselves. To me, the way I've understood it living in Canada is that a lot of doctors will get the experience here in Canada, but then they will find jobs in the US because the pay grade is so much better. And that's also why what's starting to happen is that particularly on for diseases that are more long term, like cancer, which is still deadly, but which is not an emergency situation in the same way as having a broken bone, or having a stab wound or a gunshot wound. Uh, Such diseases, you get put on the wait list. You also have to wait a long time, and it's very hard. It's painful, and people therefore have decided to start going to the US and getting operations done over there. And one of the challenges that they're facing is that they'll get the operation done in the US and they'll come back. And then they have these drugs that they need to take because they are a cancer patient, and they would have been covered if they had gotten the operation here. Now they're not covered under those drugs anymore. They're not covered by the Canadian system for those drugs. And so it really becomes a question of, do you give up your future of your health, or do you give up your financial future at the end of the day? And that's what, in the first place, the healthcare system is supposed to avoid, having to put somebody through, right? It's the whole idea of having a welfare state in this way is that we can take care of each other, and that is, I think, a major problem that's happening. Is the huge imbalance that it's creating with the amount of opportunities that are in the US for nurses and doctors. Yawer, your thoughts on the US system? What are your thoughts on the US system?
To me, the US system has always seemed very chaotic and barely um, uh, put together, barely works, super expensive. Nobody knows what's going on. There's seems to be rampant fraud. Like I see, people posting about medical bills that they got. The bill says that it's $8,000, but then your insurance covers like 7,590, so you end up paying like 400 something dollars out of pocket. And these these seem like really ridiculously extreme, weird practices that are going on there. Like nobody seems to know exactly how to solve this problem, and uh, there seems to be a huge amount of inefficiency and waste. Like other examples, like for example, people say that they go for some service, they get quoted, like $200, and then half a year later they receive a bill saying that, oh, that quote was actually wrong. It's actually $1,000. So now they're and because it's half a year later, the bill comes as past due, and it threatening in a threatening tone that you still haven't paid us, where the person didn't even know about this bill up until just now. So it seems like because of this private insurance system, they seem to have rampant cases where they're overinflating their prices for all of their healthcare services and just getting away with like whatever they ask for, because nobody can seem to negotiate with these healthcare providers and other medical services to negotiate down the prices and make sure that the prices that are being paid are the best ones possible, like you could in a single provider system. Like, countries like Canada have that. You don't have noticeable costs that you pay out of pocket for many things. You can go into your clinic and you can get like a some procedure done perhaps, and you pay a little bit of money. Maybe the rest of it's covered by insurance, by your coverage, and there's no like this chaos of like half a year later you're going to get a past due bill threatening you that you didn't pay them. So it seems like I don't know how they barely seem to be keeping it functioning. That's what it seems like to me.
A lot of doctors and nurses find opportunities to go to the US because the pays are better over there. How do we find the balance of having the right amount of services for the the citizens to avail, and yet having them in time, and having dispensation of healthcare come when it is required rather than having to wait such long durations? How do we fill the gap, basically?
I'm just going to say quickly, there seems to be two things, right? There seems to be a problem of funding and there seems to be a problem of availability of people. So for me, it's a two-pronged problem. So I don't know what you guys think about that.
In Canada, brought to mind was we have free healthcare versus the US where the cost of healthcare is higher just to get any form of healthcare. In Canada, because it's free, the question is, are you more likely to want to, because it's free for you, it's part of our taxes, that's what our daily spending goes to. Are you more likely to want to go to healthcare because it's free and you want to check yourself out, or is it that it is free, so maybe I'm willing to wait now, right? For that reason. So that's what kind of came to mind because in my mind, because I have an autoimmune condition, because it's free, I'm more likely to say, "Hey, I'm able to go to all these doctors. I'm gonna go because it's even if I'm fine, which I am, thankfully. I still go because it's free. Versus if I was back home in Pakistan, like I would rather just use it all. But I know a lot of people that because they have it, it just gives them a bit of peace. So they'll go if they get really bad and serious. Because you have this disparity of two different types of people, then there's a whole lot of people that then when they want it, then there's not enough people to suddenly.
I'm hearing you say that there is a capacity estimation issue, that because of the two different types of people, understanding what are those types of people, having a better understanding of what kind of diseases people have, and planning accordingly for capacity might actually be part of the solution, by predicting, having better predictive models around occurrences, around people showing up in hospitals, and using those models to inform the resource utilization and resource allocation might be a way of looking at it, is what I've heard out of what you just said.
Yes, and one example that I'll give that I thought of when COVID happened was we had all these office buildings that were just empty. They were people were not going to the office. A lot of people, companies gave up their offices. And so you had all these empty buildings, no one was driving there or anything. And in my head, I kept thinking, you have the hospitals are overrun with people that are, either they are actually sick or they're worried they're sick, so they're there. It would have someone who's managing resources and allocation of resources and where to put that should have come and said, hey, we have possibly dozens of buildings that are free around the city. Why don't we ask somebody if we can, take over those buildings and put those patients there so there's less overcrowding in hospitals. And that way we have the ability for more people not getting sick. You have the emergent cases and you have the less emergent cases. So it's really about proper planning in terms of the resources you do have and then catering to the people as those challenges come in. But you need someone to really come in and think about these things when these challenges come up. And it's almost like I wonder if there's like a book somewhere where they've written out these scenarios, so that they can properly allocate this for people when they really need it.
It's interesting you mentioned this because there are, as far as I remember, there were protocols written after SARS-CoV-1 around how they would manage if a similar COVID um, pandemic happened. Um,
Well, even before COVID happened, that there were protocols and there were emergency personal protective equipment supplies. There was a cache of supplies that the government had held in reserve in case of emergencies. And what had happened was that they had done like this completely by the book procedure where the cash had apparently gone past its expiry date. So they had thrown it all away, or almost all of it away, just before COVID happened. So when COVID happened, they had just thrown away all of those items.
Wow, this is news for me, by the way.
Yeah,
I did
yeah.
not know that was the story there.
This happened, yeah, in Canada, exactly.
Maybe one day we should do a deep dive on that story as well,
Yeah.
and how resources go missing within the government sphere, because of such issues. But that's a story for another time.
Yeah,
Yeah.
definitely. And if you all want to keep hearing our stories, please make sure to subscribe and keep listening to our podcast so you don't miss an episode. And you'll be able to listen to us on all sorts of platforms such as Spotify, Apple Podcasts, and much more. So yeah, as we continue the conversation, let's keep going. I see we're talking a lot about COVID and the impacts of healthcare if you're just tuning in. And I just want to, take the conversation back and end off. We're talking a lot about supply and demand of healthcare in Canada and the US. So, looking at that, is there, anything that the government is doing to help some of these challenges? I know we had discussed talking about the NDP dental plan when we, first were talking about this podcast. So I'd love your thoughts on how that might help people when we're talking about these costs of healthcare.
And I want to leave you guys with a joke. Apparently, there's research that says that people who worry too much about their health die earlier than people who don't worry so much. So, yeah, that's another thing for us to worry about.
Another thing for us to worry about. You just keep piling the worries for us. Mavish, just before we jump off, Yawar, I think Mavish asked a question around the NDP. I just want to very, very quickly cover that. So the NDP recently helped introduce the dental care program. So there's a new there is a new dental care policy in effect now in Canada, where if you're below a certain income, the government covers your dental care, which is super amazing. At the same time, the question comes up, how is that structured behind the scenes? Because I understand this is a public-private partnership. How do the private parties get involved? Is raising the question which you had raised, Yawar, around how much privatization should happen within our healthcare system. And then the other question is, how do we actually keep fulfilling demand as that demand grows within the dental care space? I think that's also a pretty interesting question to look into moving forward. Any thoughts on that, Yawar, on your side?
Yeah, I'm very interested to learn more about what the NDP has accomplished. They seem to have scored a major victory with this dental care. Uh, but I feel like, yeah, let's wait and see, what the effects are. Let's look at some statistics on what the impacts are, and we'll see if it's really as big of a win as people are hoping that it could be.
Yeah, they actually allocated about 13 billion over 5 years. So in 2023, they started that, and
Yeah.
it's I think 4.4 billion go.
Let's see where that money is spent, if and when that money is spent. Let's make sure that the money is spent in the right place, and we'll have to come back and audit that.
Yeah, for sure. And the reason why I wanted to just end off on this is because, we've had a lot of positive and negative conversations today about healthcare. And I just wanted to bring it back to say that, yes, our system is not perfect, and there's sort of things we need to work on. But there's a reason why we, started the free healthcare system in Canada, and the government is realizing that they do need to step up. So they do have plans like the dental plan to sort of help people, because dental care, above all, is one of the most expensive things. If you've ever had a dental problem, it costs a lot and is not covered by most insurance providers. The cost is actually quite a bit, even after you get that discount from your medical plan. So, it is something that's good to have for people who cannot afford it. So it is something that I think we need to tackle in future podcasts and see, where is the government actually stepping up to help people with healthcare and to help the system that they've created. So yeah, to end off on that, is there any final thoughts?
I'm gonna say that now, yeah, everybody should have pearly white teeth for Yawer's next joke, because they have access to dental care.
I am acutely aware of dental care issues because over the New Year break, my crown actually fell off. So I had a gap tooth for like more than a week before I was able to go to my dentist. My dentist finally opened up after the New Year holidays and he put my crown back in for me. So I wonder, what people with broken teeth, how they would be getting what kind of coverage they would get with the new dental care plan.
Yeah, for sure. And that's actually a very good question. What do you do if you need the dentist and everyone's closed for 4 days during the holidays?
That's a really good question.
That's
Marry a dentist, maybe.
Yeah, I don't know whether that's allowed actually. Marry a dentist and somehow they help you with all the equipment at home.
Well, then, yeah, I mean, in that case, divorce might be in the question.
Yeah, that escalated
That,
very quickly.
yeah, exactly what I was gonna say.
But I'm glad that we ended off on that note, because sometimes you ask explosive questions and get explosive responses, and that's what we're all about. So keep listening, everybody, and we'll see you next time. Make sure to give us a subscribe again and keep following for more content. Leave us a comment. Let us know if you would like us to take different directions, different ideas, and we'll see you next time in a few weeks.
Peace out.
Cheers.